Hey guys, welcome back to another lecture. In this one I'm going to talk about assessment and management of trauma. So let me start with a little introduction. I've mentioned this before, but we talk about the concept in EMS of the golden hour. And the golden hour ideally is the time that it takes from the patient's time of injury to the time that the patient is actually in the operating room. This is not the time for transport, and this does not count time in the emergency department. And this is really more of a concept than a hard fact. I've mentioned before there is actually no scientific evidence suggesting that an hour is the magic number. It was a concept that somebody kind of came up with and said, "Oh, let's make it an hour. It seems like a good time frame." The concept here, though, makes sense. We want to get these patients who are injured to the emergency room and to the operating room as quickly as possible. That requires a number of things, which starts with us actually recognizing that we have a critical trauma patient, letting the emergency room know about it in advance so that they can get all the team members necessary together to ready the physicians, ready the emergency department, ready the operating room, and get everything ready to give that patient the best care possible. Now, we don't have the golden hour because it takes time for us to get to the hospital. It takes time for the emergency room physicians to get the patient prepped for surgery and for the operating room staff to help get the patient prepped for surgery. Some interventions will happen in the emergency room before surgery and others will not. So we basically say that we have a platinum 10 minutes. We get 10 minutes worth of that hour, which means we have to work fast. That means that it's incumbent upon us as clinicians to recognize these patients quickly and transport them to an appropriate facility. An appropriate in this case is usually going to mean either a level 1 or a level 2 trauma center. The difference between these is really not that big a deal. They're both fairly capable facilities. There are other level facilities. There's like a 3, I think maybe a 4, and there's maybe even a 5, I'm not sure. But basically the level 1 and level 2 facilities are able to provide the highest level of care. They always have surgeons on call. They always have neurologists on call. They always have basically all of the medical specialties that you might possibly need are on call and available 24/7, 365. That's not necessarily true with this. The level 3, 4, and 5, they may be able to handle, kind of your minor emergencies, bumps, scrapes, even the occasional broken bone. But your level 1 or 2 trauma facility is going to be the facility that can take care of anything. Any trauma that you come across can go to a level 1 or 2. The patient's survival is going to depend on your assessment skills, because you need to assess the patient for injuries, and if you miss an injury that's life-threatening, then that's the patient's life. The patient could die if you miss an injury. So a good assessment results from an organized approach with clearly defined priorities. And then we're going to take and use mechanism, so basically how did they get hurt, to predict injuries, or at least locations of injuries. So we're going to look for patterns. So it starts with the scene size up. This is going to look real familiar to the patient assessment lecture because this is patient assessment. This is just the trauma version. So you're going to assess the scene. What is the location? Where are you? You can see in this picture you're at a railroad crossing. There's a lot going on here. What does it look like? Where is the patient? Were their seat belts used? What's the mechanism of injury? And this could be, a rollover. It could be a fall. It could be a penetrating trauma. So what actually happened? What's the amount of force? Was it a 5-mile-an-hour fender bender? Or was it a 70-mile-an-hour head-on? And what's the condition of the vehicle? And more importantly, not just the vehicle, but the interior compartment. The part where the patient sits. And I guess as far as condition, I mean if the vehicle's on fire, that's clearly an issue as well. But what does the interior compartment look like? Does it look like the patient had space to survive, or were they squished up inside? You're going to assess for hazards using all of your senses. Sight, smell. And you'll assess this throughout the call. This isn't a one-time thing. Assess the mechanism. How does the scene look, and what does it look like happened? How many patients, and where are they? And this is actually, it sounds simple, but this isn't always simple, especially on car accident scenes. Because you'll have people stop to help. You'll have family members there. You'll have, if you're near a business, the people in the business will come outside and watch. So it's really important to identify your patients and put them somewhere and tell them not to move. And to have other people stay away so that you're not confused about who is a patient. But you got to make sure and identify all of them. So if you have anybody around, make sure you go and ask if they were involved in the collision. Do you need any additional resources? And if so, what? Make sure and call and ask for it.